Hello, welcome to Carolina Plastic Surgery. My name is Saira Saini. I'm a board certified plastic surgeon. We really appreciate that you took the time today to come in so we can talk about your surgery that will be coming up in the near future. This is an information video for you to know what the possible risks are for the surgery you're about to have. The surgery that we are discussing right now is going to be the breast reduction surgery. The breast reduction surgery also includes a breast lift. We should have handed you a form that looks something like this, where you'll initial as I go along and explain each of the risks of this procedure. Under the first risk, it should say bleeding hematoma, requiring readmission to the hospital and possible surgery. With any surgery, there's always the risk of bleeding. We have you stop all your blood thinner medications, including aspirin, Motrin, ibuprofen, anything over the counter that's not prescribed for you, a minimum of 10 days, but preferably 2 weeks before surgery and for 2 weeks after surgery. Feel free to ask us when you can resume these after surgery, and we will review each of them in detail with you. The number 2 says infection abscess requiring readmission to the hospital and further surgery. Anytime you do have a break in the skin, you lose some of the protective barrier of your skin, and so you are at a risk for infection. We will give you preoperative IV antibiotics the morning of surgery, even before we go in the room. You'll get more antibiotics during surgery if it is deemed necessary, and then you'll also have oral antibiotics when you go home. Please don't stop any of the antibiotics till you discuss with us in detail. Sometimes you might get a reaction to the antibiotic. Please call us up right away when that happens, or go to the nearest emergency room if you were to get an allergic reaction. We will review when you can stop those antibiotics in your follow-up appointments. Even with the antibiotics, it's possible to get an infection that would require you to be placed on a different set of antibiotics, possibly IV antibiotics, possible admission to the hospital for IV antibiotics. If you were to develop a deeper infection, as known to you as an abscess, then you might need to have further surgery and prolonged antibiotics. Pathology. During any surgery, there is tissue that is sent to pathology for examination, and we always do this with breast surgery. Any tissue that comes out is reviewed by a pathologist. The reason we do that is that we don't want to miss any abnormal breast tissue. We're looking for a precancerous or a cancerous lesion. So all the tissues that come out of your body are sent to pathology, and when you come back for your follow-up appointment, we will let you know if everything is okay. It is very rare to find an abnormality in these pathology reports, so you should not worry, but you should ask us in your follow-up appointments about your pathology report. Definitely you will have a scar. All surgeries have a scar. Some scars are excellent and you can barely see them, but there's always a scar. The risks of hypertrophic scar and keloid are genetic tendencies, and so some people will never have had a hypertrophic scar or a keloid, but after a surgery will all of a sudden get a hypertrophic scar or a keloid. If that were to happen, we would of course work with you to get you the best outcome of your scar, and there's no way that I can give you a estimation of whether you will form a hypertrophic scar or not. The best thing to do is look at your own history of all scars you've had in the past to know if you could get a hypertrophic scar or keloid. Next, it says drain and seroma. After most breast reduction, breast lift surgeries, we'll have a drain in each breast. The drain will stay in for approximately a week. We take the drain out at the office. People are very worried that it'll be super painful. It typically is not. There is a suture holding the drain in place. We cut that suture in the office, and then the drain comes out. And then you go home, and sometimes in rare occasions that fluid that was collected in the drain may not be able to be absorbed by your body, and you might find a seroma. Again, this is rare, but if it happens, we'll work with you to make sure you get a good outcome. Garment wear, it's very important that you don't wear constricting, compressive garments after surgery, because the scar is a young tissue and it takes a while for that scar to heal. So we will want you to wear sports bras that do not have an underwire. It would be preferable if the band of the sports bra were to sit on your abdomen and not on the scar. You want something that's loose, not too tight, because you will be wearing some gauze or pads to catch any little drainage. So you want something that's comfortably fitting now, that has hooks or a zipper that closes in the front and does not have an underwire. Usually people wear these sports bras for approximately 3 months after surgery. You can wear them more if that's your preference, but a minimum of 3 months after surgery. Normally we tell people when they go home, it's preferable if they put their head up a little bit, like a head at 30 degrees, like in a recliner chair, because it's easier to get up and down and you don't have to put that much force to get yourself up. But that's also your preference. The only thing we ask is to sleep on your back, because you have those drains and it's more comfortable for you to lay on your back. Thromboembolic events, which would require readmission, prolonged treatment, and possible loss of life. This is where people get blood clots in their legs. The blood clots in their legs can cause problems with blood flow and circulation in the legs, but sometimes these blood clots can break and get lodged in your lung. That is very dangerous, and to avoid that, we ask patients to stay hydrated and to keep moving. There is no reason not to do normal physical activity like walking after surgery, as long as you feel good. And always to remember that you do everything in moderation. Start slowly and then slowly increase as you feel better. And in surgery, we use special devices called sequential compression devices on your legs. That is something we put externally that helps pump the blood back to your heart and that protects you from these events. One of the very important thing is number 10, which is asymmetry. Asymmetry is to be expected. Everybody has asymmetric breasts. Nobody's breasts are perfectly symmetric, and that's what you are to expect after surgery. If your breasts are very asymmetric before surgery, you'll have some degree of asymmetry afterwards. If they are fairly even, you will still have some asymmetry after surgery. Breastfeeding may be altered secondary to surgery on breast, number 11. Because we are taking out breast tissue and rearranging your breast tissue, it's possible that it may alter your breastfeeding. It won't apply to some patients who already have had their kids, but if you have further questions, please discuss with us and we can go into depth about that. Like we said, all the tissue that comes out of your body, your breast tissue, will go to the lab. In a rare instance, if there was diagnosed with an abnormal pathology report, you might need further treatments. The other number 13 is very important. 30% of people who have a breast reduction surgery have either a problem with the wound, either have an infection, or they have some other problem that requires further treatment. That's 3 out of 10 women. The most common thing we find is where the scar meets, where the T-scar meets at the junction. That area, it may be slow in healing. It will take 2 to 4 weeks for that area to heal, given proper wound care. If you are one of those 3 out of 10 patients, we will help you to get that wound healed. We'll teach you the techniques about wound healing. It typically does not require a surgery. It's just wound care at home to help, and then we see you, keep monitoring you closely to make sure it heals well. Also, there is another thing that affects this. It depends if you have comorbidities, if you have diabetes, if you're on steroids, if you have a BMI that's greater than 40. All of these are factors that affect wound healing. So we will help you with increasing your nutrition and improving your vitamins and teaching you proper wound care if you were to be in that small percentage of people. Even a smaller percentage of people have the wound that does not heal, that may need surgery in the form of a skin graft or reoperation and closure of the wound. If that were to happen, we would work with you to make sure that we get that problem addressed for you. The other thing that is possible is fat necrosis. Breast tissue is not very well vascularized, and parts of the breast tissue may die and it may feel like a lump. And we will, of course, be seeing you in the post-operative period, so we will be in partnering with you to see if any of these things happen. If they do happen, most of them resolve without any treatment. But if in the rare instance that something needs to be done, we might get an ultrasound of the breast and it may need further treatment. Be happy to work with you afterwards to see what would be the best result for you. One of the other things we have to make sure is that breasts get ptotic with age, and the laxity of your skin will determine how ptotic your breasts get and how fast they get ptotic after surgery. If you have ptotic breasts before, ptotic is another word for sagging breast. Eventually, given enough time, your breast will sag. The number 15 is smoking will decrease your body's ability to heal wounds. This is very crucial. You cannot smoke and have this surgery. Almost everyone will have wound breakdown that will require prolonged wound care, possible admission to the hospital for skin grafting or surgery. So it's very critical that you let us know if you are smoking or if you're exposed to secondary smoke, because that can also affect your healing. We will work with your primary care doctor to get you on a regimen to come off of the nicotine, and then we can reschedule your surgery, which is never a problem. It's just what's best for you for your recovery. People always want to know what their bra size will be or what their breast size will be after surgery. We will work with your insurance to take off close to the amount of tissue that the insurance rate requires us to take out for it to be qualified for a breast reduction. It's very hard to give you a cup size because there is no generic cup size. So we could go today to 2 different department stores and we would buy completely different bra sizes. But before surgery, we do mark and we show you exactly what breast tissue is being taken out and what the final result size of your breast will be. I'm sorry, I wish I could give you a cup size so you could have peace of mind, like, yes, I'm going to be this cup size. If it were possible, I would do it, but I just am not able to give you a cup size because of the fact that there's no standardization in the cup sizes. It's also very important, typically if you have a little backache, you might put a heat compress or have a little ankle that's twisted, you might put ice on there. You cannot do that to your breast. No heat, no ice. Just let your body take care of the healing for multiple reasons, which we can go into in depth if you like. It's not a good idea to do that. If you need to do that, just check with us, and if it's safe for you, we'll definitely have you do that. Most surgeries, as you know, the healthier you are, the better shape you're in physically, the better your outcome will be. So that's number 18. Is just it says that if you have certain health conditions, that your outcome and your recovery will be delayed. And that's most of it. When you are in the room, we'll draw your scar, show you exactly where your scar is going to be. It's going to be an anchor inverted T scar going around the nipple areolar, going down vertically, and then a horizontal scar. So like an anchor or an inverted T scar, and then the scar around your areolar. Of course, we'll draw it and show it to you. If you have any questions, we will be right back to review them in detail with you, and then I'll be back before you leave to make sure that all your questions are addressed and you know where to go next and what happens next. Thank you so much for listening to this video. I know I went over a lot of information. You're welcome to rewatch the video. We will come in and reset it for you. Thank you so much. Have a great day.